We're talking today with Jeff Power and Mark Kunkle from Power Kunkle Benefits Consulting. Gentlemen, thanks for taking time today.
Thank you.
The Affordable Care Act. A lot of people still talking about that. Employers are wondering, what am I going to need to do? What happens next? Why don't you, from the people that you work with, what are you hearing? What's their biggest concern?
I think it continues to be the rising healthcare costs. That's at the forefront. It hasn't gone away. I'm not sure that it's going to go away. And there's added complexities as far as the regulatory requirements, the compliance requirements. So those things are on their mind. Obviously, the pay or play and how they do the full-time equivalent test. Who might or who might not be eligible for a subsidy. So those are some of the things that we're hearing about from our clients.
Let's talk about that a little bit. There was some news stories right at the end of the year and the beginning of this year about the 30 hours a week and part-time, and how some companies were talking about having to let people go rather than offer them the subsidies or bring them up to full-time to get benefits. How much of that was just a lot of talk, and how much of it is real legitimate concerns?
I think it's real concerns. Employers are faced with the challenge. Many of them still want to provide the benefit, but they're concerned about the cost, what benefit levels are going to be required to be offered, the minimum essential benefits. So at the end of the day, not sure, but everybody will be seriously evaluating that and deciding to what level of benefits they can provide within their business objectives and philosophies and their benefit goals.
And I still think they're going to have to offer benefits to be a competitive employer. I mean, it's not like they're going to go away.
Right.
They're going to be modified significantly. The benefit structures are going to be modified significantly so that the employers can afford to provide these.
Yeah, it still is about retention and recruitment, so.
So when you say they're going to have to modify their plans, meaning?
They've been modifying their plans. And, we've seen higher deductibles. We've seen more employee contributions into plans. Historically, Central Pennsylvania has been like the last bastion of low deductibles. $250 deductible, $500 deductible. Those days are history. And the rest of the country's kind of been there, and we in this Central Pennsylvania geographic area have been behind.
Has all of this been something that helps people in your line of work? Are people seeking you out more for this kind of consulting?
I think it's going to be even greater going forward, because the people who then don't have benefits through their employer, and the employer is going to need guidance, and the individuals are going to need guidance who don't have benefit, who will not be getting benefits through their employer. So I think it's a two-edged thing here, that our services will be needed even more by the employers and by the individuals seeking coverage.
Yeah, most people don't like insurance, so it is complex, and they're going to need help navigating through what their options are, whether that's the public, private exchanges, traditional plans, defined contribution plans, alternative funding, and from an employer's perspective, I think there's a real big opportunity for us, because as brokers, and I'm not sure I want this exactly phrased this way in there, but the complexity and the administrative burden for employers, it is going to be so demanding, overwhelming, daunting, everything that's going to be required of them. We are heavily engaged in our clients already, but I think to a higher level there will be an opportunity for us to help them and help them through this.
Let's talk about employee wellness. That's kind of a buzzword right now. What are you seeing in terms of companies offering wellness plans, and how effective have they been? What's your experience been with them?
Well, I think the problem is that the return on investment is 3 to 5 years down the road. So we're really, for the average Berks County employer, they're just getting their feet wet in this, and it's going to be a number of years. Now, if you have, UGI or Vanity Fair with thousands of employees, that's one set of circumstances. But the average Berks County domiciled employer
50 to 100 employees.
or less than 50 are just getting their feet wet, and it takes resources. It takes employers, making a commitment, both a time commitment and a financial commitment to get involved. And I think we're just at the very entry level of that, or the beginning of that, and it's going to take 3 to 5 years before that actually, comes back in healthier employees, less claims, i.e., hopefully.
Less absenteeism.
Yeah, the whole thing.
Presenteeism.
They've been, employers who have a safety committee are now trying to meld that in with a wellness committee.
Yeah, it's often hard to keep the momentum, but I think a positive out of healthcare reform, because I was trying to tie your two questions together here, is that it really is an opportunity for everyone, employers and employees alike, to understand the system better. Like our staff has heard me say this for years and years. It is complex and difficult to understand, but it's one of the only things in life, up until recently, that you found out the cost of the services after the fact.
Right.
Okay, so that is all changing, and I think your question was specifically about wellness, but I'll take that one step farther in that it's really about employee education, and that's what we've been trying to do with our clients, is talk about employee education. And it does matter that an MRI is $800 at facility X and it's $1,200 at facility Y, and understand that and understand their benefits better, and that ties into the wellness, because 90% of Americans don't have any idea what they've spent on healthcare costs in the previous year. So again, it has to be an understanding, and it has to be an education that you may not believe it, but we are all in this together. And the only way, one of the best things we can do to help ourselves is look ourselves in the mirror and understand consumerism and what's available to us, so that we maximize the benefits for ourselves, but also paying attention to the cost at the same time.
So where do you guys stand on what the Affordable Care Act is trying to do? Do you think in the long term this is going to be a good thing? Trying to leave the politics aside?
I don't know if I can leave the politics aside. I think it's a challenge. Obviously there were some good things in the bill, from the preventive care stages, the student age 26 things. May not all be actuarially sound, everything. But I know immediately it has had an adverse impact on our rates here locally in Central PA. I was just on a webinar this morning where they talked about the excise tax to the carriers. To Capital Blue Cross, it's $29 million a year.
This is the money they're going to have to return to individual plan members, because...
No, that's the rebate. That's rebate. So this
Yeah.
is an excise tax just on insurance companies.
It has nothing to do with claims.
Okay.
Right.
What you're talking about is claims driven.
Right. So it's $29 million, which really means $42 million that they have to pay in excise tax, which equates, according to Capital Blue Cross, to their block of business, of an automatic 2% increase to premiums.
They'll just pass that along.
Sure,
Right.
that's all. The insurance company just collects money, pays claims, and it's all passed through. It's all a pass through.
The reinsurance tax, which is to go to subsidize the individuals, that's at $5.25, 63 bucks. There's another 2% right onto the premium. Then you have the durable medical equipment at 2.3%, and the pharmacy tax the first year is, I think, 3.2 billion. Actually, I wrote it down, 2.5 billion. So those things, and as Jeff said, all taxes lead to the consumer. All taxes and fees lead to the consumer. So we've started to see that in our fourth quarter new business and renewal rates, unfortunately.
And that's probably why you're seeing the deductibles that people are going up, because they want to do that to try and bring down their premium.
Right.
That would rise too much.
And it also, though, gets the actual participant to be more aware and be a better shopper for services too, because now it's his money he's spending, as opposed to when now he's got a $1,000 deductible compared to he's historically had a $250 deductible. So he's got $1,750 of his or $750, of his own money in the game.
And aside from the taxes, I think this is important because we're educating our clients, but also when we do the employee open enrollment meetings, we're also educating the employees. There has been significant underwriting changes mandated by PPACA, and they have to do no medical underwriting. But more, as important, is you can only set the rates based on age, smoker, geography, and then status or enrollment, employee singular. So where most carriers in the past have had anywhere from 7 to 10 tiers that they put, or buckets that they put people in to set the rate, under PPACA that's going to narrow down to 3. All right. 2 of our largest carriers in Central PA have provided percentages on, and a significant block of their business are going to see substantial increases just by that underwriting change under the healthcare reform bill.
So if you were to have a half an hour with the president and you could make a recommendation to make one change, what would it be?
I don't know that it's that easy. You know, we have to address the costs. We have to educate folks to make sure they access and navigate the system efficiently. In my opinion, I think malpractice/tort reform, especially in Pennsylvania, needs to be addressed.
We can't get it's very difficult to get young physicians straight out of medical school to come and practice in Pennsylvania unless they have another motivation. For example, we have a new young physician client who relocated here from Baltimore strictly because he and his wife grew up in the Lehigh Valley. And with his specialty, he found a position here in Reading so that they could be close to the parents and the grandparents of their kids. So he had another motivation. Other than that, it's very difficult. We've got more physicians who are closer to my age than we do to your age in Berks County. And those physicians are starting to retire in larger numbers. That's another issue we have, and it's tied back to the malpractice problem, malpractice insurance problem.
And that's going to have to be the last word. Gentlemen, thanks for your time again.
All right.
It's good talking with you.
Yeah,
Thank you,
appreciate
Dave.
it. Thank you.